Good afternoon, everyone. Today we'll have our updated data and modeling presentation. Secretary French will give an update on schools. Secretary Samuelson will discuss hospitals, testing, and vaccinations. And Dr. Levine will round us off with a health update. First, as we continue to keep a close eye on the data, and you'll see in Commissioner Piczek's presentation that trends in our region are encouraging. But just like everything else with this virus, there are no guarantees. The good news is Vermonters continue to step up to get boosted, so they're up to date in its rates. We also have the lowest hospitalization rates. For context, if our hospitalization rate matched the national average, we'd have over 250 people in the hospital with COVID today. If we had New York or Nevada's rate, it would be in the 300s. But I want to be clear, our hospitals are still facing stress. And I share this data only to emphasize how important it is to get vaccinated and boosted. Staying up to date protects you from severe illness and keeps people out of the hospital. And even though we leave the country, there's still about 200,000 Vermonters who are eligible for a booster but haven't received one. According to the CDC, over 95% of Vermonters over 5 have begun vaccination, and that number continues to grow. But, as well as we've done, we still need to keep working to push this number up. There's no doubt Omicron has caused disruption and stress for hospitals, schools, and businesses. So as we keep moving forward, Vermonters can help themselves and each other by doing the things we talked about for months. Get vaccinated and stay up to date. Stay home when sick. Use testing as a tool and wear a mask in crowded indoor settings. These common sense approaches work and they'll keep us heading in the right direction. So with that, I'll turn it over to Commissioner Piczek.
Thank you very much, Governor. Good afternoon, everybody. So taking a look at our presentation this week, we start with just a look across the United States map. Cases in the country have not yet seen this clear and steady decline that we're seeing here in the Northeast. But as you can see from the map, a very broad improvement across much of the Northeast and Mid-Atlantic. Parts of the country that were hit first with Omicron had the experience most significantly right before the holidays, during the holidays, and after the holidays. But still other parts of the country are seeing their cases either continue to rise or not yet plateau. But fortunately, as the governor said, we are seeing that improvement here in the Northeast. In New England in particular, cases are down 18% over the last week, down 45% over the last 2 weeks. On the next slide, you'll see Vermont overlaid with all of the Northeast states. You can see that the other states in the region did see Omicron, an impact from Omicron earlier than Vermont. And for the most part, for all of those states, the impact was also more significant in terms of their case counts on a per capita basis got higher than Vermont, and they saw more case counts than Vermont. So a few of those states like New Jersey, New York, and Connecticut, their cases have been coming down around 50 to 60% since their peak. Vermont, we're down about 30 to 40%, so that's really good improvement, but we're a little bit behind, maybe by a week or 10 days, some of these other states that saw a much more significant and early impact from Omicron. So getting to Vermont's cases, you'll see that our 7-day average is just over 1,121 cases. Again, down 27% over the last 7 days, down 37% over the last 2 weeks. So again, some really good news here in terms of the trend that we're seeing, but then again, a reminder that our cases continue to be averaging over 1,000 a day. So we want to continue to see those trends go down and want to see some much continued improvement before we are comfortable that things are significantly different than they are at the moment. You'll see that testing has come down over the last week or so, down about 17%. But again, our cases are down more significantly than that, down about 27%. So the case reduction that we're seeing in Vermont, not an artifact of simply a reduction in testing, does appear to be a real decrease, and there's other metrics to support that as well. Looking at higher education, you'll see one of those examples. We had fewer cases on campus this week, although over 300 cases. But that was when colleges were doing significantly more testing as well, about 2,500 more tests this week compared to last. So more testing this week on college campuses, but fewer cases identified. So one example of certainly improvement. One place where we haven't seen that improvement yet is in long-term care facilities. So there are 25 active outbreaks in long-term care facilities. The chart that we show here is showing the facilities that have cases identified. There's about 10 that are not on this chart where the number of cases are not shown, but in total it's 25 outbreaks and 325 active cases associated with those outbreaks, and I think Dr. Levine will have a little bit more information on that. So turning to the next slide, you'll see this is the forecast page. So again, we anticipate that this trend will continue, that we will see cases come down in Vermont over the next 2 to 3 weeks, that through the end of February, hopefully they'll get to a much lower place than they are today, which is certainly very good news. The trend down is occurring more quickly than we thought it would. We thought we'd start to see this at the end of January. You know, we've been seeing it now for about 14 days, so confident that the trend is moving in the right direction, but again, cases are still high relative to what we were experiencing prior to Omicron. The other thing that we'll keep a close eye on is some of these international jurisdictions that saw a really significant Omicron peak and then decrease, in particular the UK, Canada, and South Africa. So in all of those cases, they have seen their COVID-19 positive rate start to slow down in terms of the decrease in recent days. So we want to see if they're going to plateau out at a certain point or if they're going to continue to see their cases drop to a very low level. That's what we'd hope to see, but want to keep a close eye on that. And for the moment, at least in a couple of these jurisdictions, it does seem like their cases are plateauing out, maybe at a little bit higher level than they want to see. So again, just another word of caution as we look to these improved trends in the Northeast and in Vermont. Looking at our statewide hospital numbers, you can see that up about 7%. So this is just starting to see some slowdown in our hospital figures overall. We're still reporting over 100 people in the hospital and have been for about 11 days. But we do anticipate starting to see hospitalizations come down over the next week and continue to come down as fewer cases are reported in Vermont. So that means that there are fewer people going to the hospital that need to be treated for COVID. But because there'll be less cases circulating, there'll also be fewer people who are admitted to the hospital for other reasons who happen to test positive while there. So as cases come down, we should see those hospitalization numbers come down for both of those reasons. On the ICU side, we are already starting to see some improvement. The ICU numbers are down about 4% over the last week. And you can see that majority of those in the ICU, as in with general hospital beds, are those who are not vaccinated. Looking at our slide that we show every week about that difference between those who are not fully vaccinated versus those who are fully vaccinated and boosted, you can still see that significant difference. Now we have about 280,000 Vermonters who are fully vaccinated and boosted. That population continues to grow, but the number of people requiring hospitalization in that group remains pretty steady. And again, about 11 times difference for those who are fully vaccinated and boosted compared to those who are not fully vaccinated. Another emphasis that we want to make note of is the fact that older Vermonters continue to go to the hospital at a greater rate than any other age group. So you can see here the per capita numbers. Those over 65 much more likely to end up in the hospital regardless of their vaccination status. It's just a fact across the board, although vaccination makes it less likely that you'll need to go to the hospital and that your duration of hospitalization stay will be shorter as well. But again, for those that are in that vulnerable category, something to be mindful of over the next few weeks as cases come down. Fortunately, on the next slide, you'll see that the reported cases of the flu in the hospital, those that need to be hospitalized for the flu, have remained very low so far this year. So that's certainly good news as it relates to not having additional pressure in our hospital systems. And we'll, again, hopefully see that continue to stay low through the rest of the flu season. In terms of hospitalizations across New England, we mentioned that we think we'll start to see our hospitalizations fall over the next week. You can start to see some of those other states within the Northeast, New York, Connecticut, Massachusetts, they're starting to see their hospitalization numbers already clearly tick down. Again, we think we're just about a week or so behind some of these jurisdictions. We think we'll start to see the same thing over the next week. But even as our hospital improvement has sort of just hopefully started, one thing that we are seeing clearly is an increase in the availability of hospital beds, which certainly is good news. As of today, 65 hospital beds available, 22 ICU beds available. So we've had a trend down in terms of the availability of those types of resources, but that has shifted over the last few days, and we're starting to see more availability across the hospitals. So looking at our COVID-19 fatalities, now 523 fatalities for the entire pandemic. You can see we had 43 deaths for the month of January. And just want to make a note of those deaths that we saw for the month of January to date of the 43. So the majority of those deaths, when you look at when they tested positive and when they would have been infected, occurred when the Delta variant was the dominant variant in Vermont. A minority of those deaths have occurred when Omicron was clearly the dominant variant in Vermont. So we do anticipate, that the death rate will stay higher until maybe 2 or 3 weeks from now, once cases have come down. But we also have to be mindful that a lot of the fatalities that we've been seeing in the month of January were due to the more severe Delta variant rather than the Omicron variant that has become dominant over the last 2 or 3 weeks. And again, as we continue to show pretty clearly that if you are not vaccinated and boosted, you have a much greater chance of death if you do contract COVID-19. So over a 9 times difference over the last 6 weeks for those who are not fully vaccinated compared to those who are fully vaccinated and boosted. And then just finally here, a couple of updates on vaccination slides. You can see Vermont continues to lead the nation in those 5 to 11 who have started vaccination, up to 61.6%. And over 50% now fully vaccinated. And as the governor said, Vermonters continue to go and get boosted. Just about 7,800 Vermonters over the last week got their booster shot, so we still have a few 100,000 that are eligible. We need more and more Vermonters to get that booster shot to put this Omicron wave behind us. And we are doing a pretty good job, averaging about 10,000 a week, but we want to see that remain steady and even increase. So if you haven't gotten your booster shot yet, certainly make sure you do that at your earliest convenience. And with that, I'll now turn it over to Secretary French.
Thank you, Commissioner Pichek. Good afternoon. Many of our school districts are now transitioning to our new test at home strategy. Before I get into an update on how that's going, I just wanted to recap what that strategy is and why we had to make that change. Test at home expands the use of testing in schools by using antigen tests, which give immediate results. This expansion of testing is coupled with a change in how we are notifying presumed contacts in schools. Previously, this notification process happened through a labor-intensive and relatively slow process of contact tracing. With tests at home, the old contact tracing process in school has been replaced with a more general response notification process. Although tests at home greatly expands testing, the use of the testing is tied to specific protocols that are founded in our revised guidance at the state level for isolation and quarantine. Basically, these tests are used in schools dependent on the vaccination status of individuals. When vaccinated individuals are presumed contacts, they are eligible to take home 2 tests to be administered on the 4th and 5th day after their presumed contact, and they would continue to attend school. Unvaccinated individuals who are presumed contacts are eligible to take home 5 tests, which would be administered daily. They too would continue to attend school if they test negative each day. Another component of test to home is school nurses will have tests to conduct screening of symptomatic individuals in schools. This is important since many of the milder symptoms of common colds are like those of COVID-19. So why did we have to make this shift in our policy? The short answer is we had to. It became clear that what we were doing before was not going to work with Omicron, which is more infectious and transmits more rapidly. We saw this play out immediately after the holiday vacation when Omicron was starting to take hold in the state. We saw several schools close not only because of new cases, but because they were placing many students in quarantine because of a backlog in contact tracing. We also saw several districts have difficulty with our guidance on stay home when sick. Schools did not have the capacity or the tools to discern the difference between mild cold symptoms and COVID-19 symptoms, so they erred on the side of safety. School nurses, who typically would have been involved in making these kinds of clinical decisions, often didn't have sufficient time to do so because they were directly involved in the logistics of both test to stay and contact tracing. So test at home was a necessary evolution in our strategy. We made this shift because we had to, not because the timing was ideal, or for that matter, even good. In fact, this is one of the more challenging moments we've seen in schools during the pandemic. But we are working together as we speak, and I'm confident as we get through this moment successfully, we'll get through it just like we have all the other twists and turns that this virus has sent us. Test to home is dependent on the supply of tests. We've been working closely with our partner agencies to ensure schools have enough supplies to implement the program. It is part of a broader state strategy to deploy rapid antigen tests in our communities. Secretary Samuelson will provide an update on that larger testing effort in her report. We have had situations where schools have run out of tests sooner than projected. In an environment of these very high case counts, some districts have gone through their supply more quickly than others. When this happens, we rush to provide tests to them as quickly as possible. I just want to reassure parents, if your district runs out, don't worry. They will have more tests soon, and schools will remain open, and you should send your child to school regardless. We are confident we can manage the supply for this program, but we're also working on the demand. And the demand for the tests is not just a function of case counts. It's also a function of us needing to further refine and explain our guidance so the tests are being handled out in accordance with our recommendations. We are working with school districts to develop additional guidance in the form of FAQs, frequently asked questions, to refine our protocols, and that's ongoing work that started last week. Our overarching goal is to make Test at Home as simple as possible to implement, but the flip side of that simplicity is the need to be able to manage and predict supply. This will become easier to do so as we continue to iron out the practical aspects of implementing the program, and certainly become easier to do as hopefully case counts continue to come down. I am asking Vermont families continue to have patience as schools work through the specifics of the new program. Schools are still at the beginning phase of implementing it, and we're working closely with them to troubleshoot it to make sure it can be implemented in every single district in the state. With the transition to the broader deployment of antigen tests and their administration at home, we have lost some of our reporting capability on cases that could be directly attributed to schools. As a result, we stopped updating the school report on the Health Department website as of January 10th. Lastly, I wanted to provide an update on Pcr surveillance testing. We are planning to sunset the state-level program in the coming weeks. We will work with districts, however, who are interested in maintaining some form of PCR testing availability in their districts. Districts will have access to LAMP testing as well, which, like PCR, is a confirmable test, but has the advantage of giving immediate results. That concludes my update. I'll now turn it over to Secretary Samuelson.
Good afternoon. Today I'll provide an update on our COVID preparedness. I will review the work completed over the last 2 months and highlight Vermont's and Vermonters' ability to adjust and respond to the ever-changing pandemic. We have watched the data carefully, observed what was happening in other countries and other states with Omicron, and used that information to help Vermonters plan and prepare. In some cases, like vaccines, we knew that our existing tools were our best options and defense. In other areas, like testing, contact tracing, and hospital capacity, we identified ways to adjust in response to the high transmissibility of the Omicron variant. The ability to monitor the data and evolve our response has been a key to Vermont's COVID operations. We are now about a month into the Omicron stage of this ongoing pandemic. I'm going to walk through each of the areas of operations, starting with vaccines, then testing, contact tracing, and hospital capacity. and identify what's happening in each of these areas based on the stage that we're currently at. First, and most importantly, we continue our efforts to get as many people vaccinated and boosted as possible. This is our best defense against significant poor outcomes related to COVID and hospitalizations, including with the Omicron variant. As of today, as Commissioner Pcek said, more than 50% of children between the ages of 5 to 11 are currently vaccinated. And over 57% of Vermonters aged 12 and up are currently up to date. While these vaccination rates are leading the nation, we hope to see more Vermonters become up to date in their vaccinations. And we continue to make vaccinations as convenient and easy as possible to get, including boosters, which are widely available across the state. In December and January, Vermonters received over 195,000 doses of COVID vaccine at pharmacies, public health clinics, through our healthcare providers, and through other providers. With the recent updates to the recommendations for children and booster vaccines and on boosters, there continues to be a focus on school vaccines, including 145 clinics offered in December and January, and 38 clinics scheduled in schools between now and early February. In addition, we are spreading out into the communities and going to events, work sites, and other areas where Vermonters are congregating to make it easier for them to get vaccines. This includes holiday shopping, work sites, and ski resorts, and more recently, winter festivals. We have more than 98 clinics spread across the state in December and January so far. We currently have 65 clinics planned through the end of February, and we're adding more every day. To schedule an appointment, you can go to healthvermont.gov/COVID-19/vaccines. If you're an employer, a community organization, or a group holding a gathering, we would be excited to come to you. Simply contact us by going to healthvermont.gov and clicking on your community. Testing is an area where we've had significant effort. We have evolved our testing strategy that, in addition to offering PCR tests, which have been critical throughout the pandemic, we are working to get many rapid tests into the hands of Vermonters to take home, where they can test in the privacy of their own home. In the face of national shortages, we've still been able to expand the supply of rapid tests coming into Vermont. As part of this effort, since early December, we have increased the number of test manufacturers that we're supplying for tests in Vermont from 1 to 5, and that has allowed us to focus on getting tests to vulnerable Vermonters, keeping schools open, and ensuring that critical infrastructure is able to operate. We've done this all the while continuing to make sure that we're getting rapid tests in the hands of the general public. All told, more than 1 million rapid tests have been distributed in Vermont since late December. For the general population, that's been more than 450,000 tests, or more than 100,000 distributed through public testing sites, and 350,000 distributed through the online program Say Yes, which was conducted in partnership with the National Institutes of Health. Focusing on schools, more than 175,000 tests were targeted for the return to the K-12 schools after the holiday break. In addition, in the month of January, more than 440,000 rapid tests have gone out to advance several of our testing programs, as discussed by Secretary French, and also for schools, and also for our child care providers. This effort is designed to keep kids in schools and in classrooms, and children in their daycare providers. That's more than 600,000 tests focusing on keeping kids in schools and in child care. For our vulnerable Vermonters, since late December, 30,000 rapid tests have been distributed through organizations serving our BIPOC community, through food shelves, homeless shelters, emergency housing sites, senior centers, after-school programs, libraries, and churches and parent-child centers, just to name a few. Plans are in place to double that amount, hoping to distribute an additional 30,000 kits to these partners in the coming weeks. It's important to remember that the expansion of the rapid tests are on top of our PCR testing system. Over the same time frame, from December through today, Vermonters have accessed more than 300,000 PCR tests through the public testing programs and sites. This includes through healthcare providers, employers, and other providers across the state. As we look forward, we will continue to maintain our PCR-based testing system and expand the availability of rapid take-home tests. Through the federal government, individuals in Vermont can also get tests online by going to covidtests.gov. You can also call 855-722-7878 if you're interested in finding out more about when it's appropriate to test and when not. On contact tracing, Vermont stood up one of the best contact tracing programs in the country, and it has truly slowed down the spread of COVID. But traditional contact tracing done by health officials is less effective with the more transmissible Omicron variant, and Vermont has pivoted towards arming Vermonters with information they need to isolate and reach out to their contacts. This transition started nearly 2 months ago, as has been discussed in several press conferences, with the newest evolutions occurring in just earlier this month. Dr. Levine will cover it in more detail momentarily, but it's important to note that our evolution in contact tracing is part of our strategy to follow the science and the data and to keep pace with the COVID variants. And it's in line with our national experts. Lastly, on our healthcare system, we continue to fund 139 subacute beds, which allows hospitals to transfer patients who no longer need hospital level of care to subacute settings. This helps to reduce the pressure on our hospital system. Like other components of our pandemic operations, ensuring the continuity of operations in our healthcare system has evolved. Over the past 3 weeks, the burden on hospitals and healthcare settings has shifted from the number of cases in the hospitals to the number of staff who were out due to the COVID. Vermont has managed to maintain the staffing needs to keep our hospitals and healthcare organizations functional, initially by bringing in 30 EMS staff and paramedics from FEMA to 3 hospitals. That cadre has now been reduced to 20. We recognize that other states had greater needs and anticipated this decline in the FEMA staffing. With this in mind, we leveraged a statewide staffing contract to bring more staff to our healthcare providers. Today, 104 staff are available in long-term care facilities, hospitals, and human services providers through the healthcare staffing company TLC, with more than 30 staff on their way to Vermont by the end of the month. This crucial resource most and are to best serve Vermonters and our healthcare system. Finally, 27 members of the National Guard are supporting some of our hospitals by providing food service, maintenance, phlebotomy, and patient observers. This help is critical. Through these efforts, as we change and adapt our policies and programs, our healthcare workers are holding strong, but they could use your recognition and encouragement. As you'll recall, at the beginning of the pandemic, there was a lot of footage both in Vermont and across the country of Americans going outside and expressing their gratitude and showing solidarity in various ways for healthcare providers, including first responders. As we move into the 3rd year of managing the pandemic, healthcare workers have been on the front lines vaccinating, testing, and caring for those who are sick. So if you know someone who works in the healthcare field, no matter what they do, give them a call, send them a text, or drop them an email to let them know that you're grateful for their work. And if you're unvaccinated, the best thing you can do is to get vaccinated to show your support for them. And I'd also want to thank all of the state employees for their work and unprecedented collaboration supporting our testing, tracing, and vaccines and other operations. These dedicated state employees continue to work in partnership with so many Vermonters to support the response and infrastructure we have in place. With all of that said, I'd like to turn it over to Public Health Commissioner Dr. Levine.
Thank you.
So we are continuing to see hopeful signs from the latest surge driven by the Omicron variant. As you've seen, cases appear to have peaked in the Northeast and are on the downslope. We hope this will lead to lower rates of transmission here in Vermont over the next coming weeks, something we'd all very much welcome. Now, our case rates are following an improving trend. We've also seen corroborating evidence from our Burlington wastewater collection showing improvements in the levels of Omicron detected in all of the stations that are tested in that municipality. Now, one key indicator, which is our hospitalization rate, which was considered high, but as you saw, that's for Vermont, and the governor has aptly illustrated the fact that it is certainly not high when compared to the national experience. And these numbers have come down from their prior peak and are really in a steady range over the last week or so. ICU bed availability has been sufficient, and on any given day, at most, only a handful of ICU patients are on ventilators. This is testimony both to the presumed lower virulence of Omicron, but also our ability to manage a patient's breathing in non-invasive ways. Now, many of you have been asking for some time and have questions about how do we count COVID hospitalizations. In short, there are two categories: those who are hospitalized for COVID and those who are diagnosed with it after being hospitalized for other reasons. Of the people in the hospital who have COVID, about 67% went in because of their COVID-related illness. And about a third were in the latter category, where they were in for another reason but tested positive for COVID. Suffice it to say, though, that every one of these patients are treated and attended to as appropriate for their COVID status and require significant hospital resources and manpower. Things like, do they require isolation? How are they provided for with hospital resources, PPE, staff exposure? All other aspects of hospitalization remain important for both groups. Now, while we look forward to a time when less virus is in our communities, we need to remember COVID is still here. Case rates lower than the peak are far from zero. It is not going away just yet. We've seen how quickly the virus can and does change, but the good news is that it continues, that Omicron seems much milder for many people, especially those who've been vaccinated and boosted. Now, while I am certainly delighted that our state ranks first in the percentage of Vermonters who have been boosted, and I firmly believe much of our favorable hospitalization data is because we are so highly boosted, I must once again emphasize that being over 50 or 60% boosted for the age 18 and over population is still not nearly good enough. I'd love to see that percentage much closer to 90. So if you are eligible and haven't yet gotten around to it, please jump up, go out today and get your booster. It takes almost no time at all, or at least make a plan to do so by the end of this week. Now, we use the term variants a lot. Allow me to remind you that variants are viral mutations. The mutation of viruses is a lot like evolution in real-time overdrive. With a planet of people to work with, COVID has certainly fine-tuned its ability to spread. The Omicron variant is so contagious it causes many infections still, and compelling public health officials worldwide to quickly consider how best to respond to this evolving situation. Now, Vermont began adjusting its strategy earlier this month. We've begun moving to rapid testing in schools and discontinued the slow, laborious, and increasingly ineffective process of universal contact tracing, replacing it with a much more targeted effort in the age of Omicron. This strategy, I'm delighted to say, today has now been supported by national public health leaders, the Association of State and Territorial Health Officials, the Council of State and Territorial Epidemiologists, and other leading public health organizations just released a statement supporting health departments in making just this type of transition away from universal contact tracing and case investigation. In their statement, they note many of the points we've spoken of here previously. The shorter incubation period of Omicron, which means the highest risk of transmission occurs before symptoms begin or before a positive test. The large number of infections that are asymptomatic or mild cases, which often means many people never seek testing. Mild cases that never undergo testing and the results of self-tests that are not reported. And widespread vaccination, which is protecting a large portion of us from the most severe outcomes. So this is why we are continuing with this shift in Vermont, fully moving away from contact tracing for the general population, as it is simply no longer effective against this fast-moving variant. We continue to base such decisions on the current science, evaluating the data, and evolving our practices so as to protect and promote the best health for Vermonters. Now, the health department had already been prioritizing contact tracing for those at higher risk and asking all Vermonters who tested positive to isolate immediately and reach out to close contacts. Let me assure you that contact tracing for COVID will still be done in certain high-risk settings, like congregate residential settings, long-term care facilities, shelters, correctional facilities, where it can still have an impact. And it remains an important public health tool and will continue to be used for many other important infectious diseases, just not the current variant of SARS-CoV-2. On an individual basis, the health department will be contacting all Vermonters who have tested positive for COVID-19 when we receive a lab result. This will help ensure that people quickly receive the guidance they need to isolate and notify their own contacts, as we've already been asking them to do. They'll also be connected to specific resources if they are in need. So if you do get a call from the health department, please know it is likely because we've received a positive result, and answer the call you need to make sure you have the information you need to protect yourself, your loved ones, and your community. It'll be a very brief call, since there won't be a lot of questions asked about your exposures or your contacts. The reason for the call is to go over the steps to take now and talk about what needs you may have. With these tools, we can empower Vermonters to act quickly to slow the further spread of the virus right now. During the Omicron surge, it's critical to stay home if you feel sick, wear a mask indoors, avoid crowds, and gather safely. Help encourage others to get vaccinated and boosted. And although treatments for COVID are limited by the federal supply right now, please reach out to your healthcare provider if you are at higher risk and have tested positive. I also want to speak very briefly about concerns that student athletes, their parents, the VPA, and schools have regarding return to play after COVID. The pandemic has led to a seemingly endless set of complex hoops for us all to jump through. Not the least are families and schools trying to manage all aspects of education and extracurriculars. Keep in mind that Omicron has only been in this country and this state on the order of weeks and not months. The national organizations that set guidelines and provide guidance to our healthcare professionals are working quickly to try to bring their guidance in line with the science as it develops real time. I can't promise that these recommendations will unfold any less complicated than they have, but I can assure everyone that any requirements will continue to be driven by the science and the medical decision-making process of pediatricians, providers, and students and families. all with the goal of safeguarding the health of the individuals as well as their fellow athletes and their school community. I want to end on a final note to address a topic that seems to be coming up more now that we're dealing with a relatively milder variant in a highly vaccinated population. Should we all just get COVID and get it over with? My answer is no, and I'll give you a few reasons why. Even though many of us are vaccinated and highly protected from serious outcomes, we cannot always predict who may become seriously ill. Also, our hospitals remain strained, albeit more by workforce issues than bed capacity. And if you do get sick enough to go to the hospital, you may face delays in care, and you'd only be adding to their strain. Your own health may be just fine, but you could still spread the virus to someone else who's too young to get vaccinated or is vulnerable and at higher risk for COVID. No one wants to be sick now. Even milder COVID symptoms can be miserable for some, and the inconveniences of having to miss school or work while you're isolating can really add up. Not to mention, we still don't have a lot of data about Omicron and long COVID, or whether and how soon you could be infected again. And we do expect more treatment options are on the way, in addition to access to rapid tests and high-quality masks. The longer we can avoid getting Omicron, the more likely we are to have more options to protect ourselves and others moving forward. As always, I want to thank all Vermonters for their patience during this tumultuous time. I know how difficult it is to adjust to changing guidance as new science comes to light, but I hope we can all maintain our shared value for public health as we begin to emerge from this latest surge together. Governor?